all, welcome back to my channel MPH Capsule Talks. Today we are going to talk about comprehensive healthcare and primary healthcare. Comprehensive healthcare is an approach to provide care for whole patient and all of his needs. You might be aware that we had certain health planning committees in India. They proposed important guidelines for the health and welfare of the nation. It was in 1946 the British India government appointed Sir Joseph Bore, an Indian civil servant, to formulate a committee to review the health services and make recommendations to improve the same. One of the recommendations of Bore committee was comprehensive healthcare. It is otherwise called the womb-to-tomb approach just because the care is from the birth till the death of a person. Certain criteria should be fulfilled to call it a comprehensive health care. Number 1, provide adequate preventive, curative and primitive health services. Number 2, be as close to the beneficiaries as possible. Number 3 is have the widest cooperation between the people, the service and the profession. Number 4 is to ensure the availability of all irrespective of the ability to pay. Number 5 is to look after specifically the vulnerable and weaker section of the community. Number 6 is to create and maintain a healthy environment both in homes as well as working places. It is this concept formed from the board recommendations that led to the formation of primary health centers and sub-centers. Talking about primary health care, it was in 1978 WHO Almaty Declaration adopted the concept called primary health care. Primary health care ensures people receive comprehensive health care. It has all the hallmarks of primary healthcare delivery first proposed by Bore Committee. According to WHO definition, in 1978, primary healthcare is essential healthcare made universally accessible to individuals and acceptable to them through their full participation and at a cost the community and the country can afford. The main purpose of primary healthcare was to increase life expectancy, improve nutritional status, provide basic sanitation, and development of manpower and other resources. According to Almaty Declaration, primary healthcare have 8 elements. First is a health education about the prevailing health problems and the methods of preventing and controlling them. Number 2 is promotion of food supply and nutrition. Number 3 is an adequate supply of safe water and basic sanitation. Number 4 is a maternal and child health care including family planning. Number 5 is immunization against major infectious diseases. Number 6 is prevention and control of locally endemic diseases. Number 7 is the appropriate treatment of common diseases and injuries. Number 8 is the prevention of essential drugs. Then coming to the principles of primary health care. There are mainly 4 principles. First is the equitable distribution, which means the services should be given to everyone whether in the rural or the urban area. This is a horizontal equity. There should be a vertical equity as well, treating the people in proportion of their inequality. For example, focusing more on the vulnerable people or people from the rural area. Secondly, the community participation, it can be of 2 types, active and passive. Active participation includes both cooperation and sharing of resources, whereas in the passive, they provide cooperation alone. The main advantage of community participation is that it helps to increase the program acceptance and better understanding of community needs, as well as to reduce the cost of implementation by using the local resources. Barefoot Doctors in China is a good example of community participation where the rural farm workers are trained both traditional and Western medicine to work as community health workers. Third is intersectoral coordination, the coordination with different sectors such as agriculture, animal husbandry, food industry, education, housing, public work and communication, which helps to improve the health status of the community. The sectoral coordination helps in participatory decision-making and joint evaluation. On the other hand, the difficulties faced are the conflicts of interest and the past struggles. The best example of intersectoral coordination in India is the midday meal program by the coordinated effort of the educational and the healthcare department, thus aiming to increase the literacy rate as well as to prevent malnutrition among the children. The last principle is appropriate technology. The technology used for healthcare services should be scientifically sound as well as socially acceptable and should not cost too much. For example, ORS for rehydration, which is cheaper as well as scientifically valid and acceptable therapy. So that's all for today. Hope this video helped you to understand what comprehensive healthcare and primary healthcare is. Thanks for watching my video. Please like, comment and subscribe to my channel. See you guys with another topic. Till then, bye-bye.